Hi, I'm Rosemary Clee, the Executive Director for the Bergen New Bridge Medical Center Foundation, New Jersey's largest not-for-profit hospital, and the sponsor of In the Know with Ro, an informative conversation with leading clinicians on important health topics. Today I'm joined by Kris Pendy, the Chief Clinical Officer for Behavioral Health Services at Bergen New Bridge Medical Center. She is a well-respected thought leader in the behavioral health field, the point person for numerous community partnerships, joint ventures, training forums, and grant opportunities. Kris is a licensed clinical social worker and has a master's in social work from Rutgers University. She holds a clinical supervision certification and a seminar in Field 1 instructor certification. Welcome, Kris.
Thank you, Rosemary.
This is Mental Health Awareness Month, so perhaps a good way for us to begin today is for you to give us an overview of the mental health services available at Bergen New Bridge.
Absolutely. As many people know, Bergen New Bridge Medical Center has a very large service provision for our mental health residents throughout the state of New Jersey, but most clearly here in Bergen County and in the northern region. We host a large number of outpatient clinical programs, both for mental health services, for co-occurring services, where you have both some addiction, substance abuse issues, along with mental health issues, as well as services that are for our straight addiction consumers in our community. We also host a large number, 323 to be exact, inpatient beds that provide a variety of care for folks in need at one of the most difficult times in their lives, when they need to make the decision to come and receive inpatient care. The services are very wide ranging. They are from the most acute level of service to further through the process where perhaps you need to stay with us a longer period of time for a better, more comprehensive discharge plan, or for other services that we need to link and connect you to. The services here at the hospital are for all age ranges. We have inpatient and outpatient services that span both from our children, including one of the only inpatient units in Bergen County for crisis services, inpatient for children, as well as all the way through for our seniors who have both the need for potentially long-term care placement, but also have mental health issues that really require a specialized level of care. And we provide that here at Bergen New Bridge Medical Center.
So do we offer virtual visits?
Absolutely. We, as many in our community and in our profession have had to do, we've all had to pivot quite quickly to a virtual platform in a variety of different ways. Most certainly in our outpatient level of care, we have the ability to do both in person here at the medical center, as well as virtual services on a platform that is HIPAA compliant, that will, be able to meet the needs in a moment for the folks that are reaching out to us for care. But we also have very expansive virtual services on our inpatient level of care. Whilst we were, whilst we all struggle with the pandemic and social distancing and the need to be, very protective of our health and our well-being, not just our mental health, but also our physical health, we have had to use many of the platforms virtually to be able to enhance our care at the same time that we were able to keep people comfortable and safe with the way that we were able to provide those services during the surge of the pandemic, but even now, as we are hoping to be exiting and being on a safer level. But we provide a large number of services in that way, so that it really, at this point, is really up to the consumers that are seeking out care from Bergen New Bridge Medical Center if they'd like to come in person, and we encourage that. We are a safe, full-ranged medical center. We're also sensitive to the fact that some folks perhaps are not ready yet, They have a variety of reasons why they might not be prepared to come in person. And so we do offer those virtual services to them as needed.
Okay. So how prevalent are mental health illnesses?
When we look at the state of New Jersey, right now in the state of New Jersey, in the nation, the state of New Jersey ranks 13th in the prevalence of adult mental health, needs in our community. The numbers can change depending on the various different sources that you'll look at, Mental Health America, and a variety of different entities. But I think what's really important for us to note is, what does that mean to have a mental health diagnosis or a mental health issue? When we talk about what stigma means, if I have an anxiety disorder that I don't want to talk to you about, do I count in that number or don't count in that number? How are those numbers achieved? So I think what's really important to know is that all of us struggle with something in our lives. We all have some stressors, financial, familial, children, work, all of which cause us to at times need to seek out and gain guidance from someone that we can say, I'm not doing okay today, and I'd like to be doing better, and I need to talk through what that may be. We all need a neutral someone, and it's okay to seek out care. When we look at strong diagnoses of mental health, schizophrenia, bipolar, these are the numbers that somebody is going to start to collect because they're diagnosis based, right, and say the prevalence is every 1 in 4. Mm-hmm. So I think what's important for us to focus on is that we all need help, particularly as we look at going through this recent pandemic. And some of us need more help than others. And it's okay to need help. It's okay to seek help. And we need to teach our children that there isn't anything wrong with that need to seek out help. We have to start very early on to be able to normalize that, just like having diabetes, just like having a weight issue, just like having a blood pressure issue, or any of the known standard medical conditions, just like having to take our children to the pediatrician and have a checkup on a regular basis. It is okay for us to be checking in about our mental health and getting the services and support that will benefit us and those we love, so that they remain healthy and happy through their lifetime, so that we don't create the circumstances that have been created in the past where people are afraid to seek help, or they feel that they will be looked at differently and stigmatized because of that. When we look at our young folks, children will go to their guidance counselors in high school, and seek out support for college and seek out support for decision making about their future. But more often than not now, a lot of students will seek out their guidance counselor for support with their mental health issues and concerns, and potentially those that they can't talk about at home. What we see now is that it can be stigmatizing to go to your guidance counselor, because now it's more than going, because you're seeking out guidance on your schedule or seeking out guidance on your career path. And these are the places where, again, we need to normalize that it's okay, just like it's okay to get a health checkup, it's okay to get a mental health checkup, because the two are not separable. They are intertangled, and they are who we are as a whole person.
So is there a difference between going through a mental health crisis and having a mental health diagnosis?
So, I think that diagnoses can be tricky. Mm-hmm. I've had many experiences working with many folks through my career, that one of the biggest issues that they'll have is, can I pay cash so that something doesn't go through my insurance company? Mm-hmm. Or they don't want that actual diagnosis of anxiety or depression, to be present in their file, to be available in some way in the world that someone could then use it against them, whether it be separating a marriage, caring for and getting childcare for your family members, employment, even though we know that these things are protected, and really something that people can't gain access to via HIPAA. There is still that fear and that worry and that concern that being diagnosed means something more than you need to get care for a particular issue that you're struggling with. Taking an anxiety medication so that you feel more calm and more capable in what's happening for you, because they can present physically, allows you to be calmer in the moment and be able to manage a situation. There's just nothing wrong with that. But unfortunately, we're still not in a place as a society that we can accept that that's okay. And so the difference in those two situations is very personal to each individual. One person may be like, I have anxiety, I'm okay with it. I have depression, I take medication. And the next person may never want to share that information. And it's okay either way. But that fear sometimes holds many people back from going and getting the care that they need, because they don't want somebody to know. They don't want to run into somebody. They don't want somebody to be aware and speak about it, and then it to become something that they didn't want shared, because there is this giant stigma still in our country and in our world about actually having to seek out that kind of care.
And I'm sure that during this time, you've seen an increase of services during the pandemic.
We have, when we have looked at, we'll take June, was a time where we had really been through the largest of the surges of the pandemic. We learned a lot. We started to understand what COVID-19 was and how the virus spread, and some of the measures that we could take to protect ourselves as a nation and as a world. And when we started to look at some of the statistics that are available for us, June was a time where we hit a little bit of a lull before we had vaccinations, and then had some of the variants come out and a little bit of a surge again. And across the board, we saw significant increases, 31% increase in anxiety disorders and symptoms expressed by folks, trauma and stress, financial stressors that created anxieties and concerns, an increase in substance use to manage and self-medicate some of the experiences that we were having. And then you add that to folks who have a mental health diagnosis, already are receiving treatment, who perhaps are struggling with things like that already, and they were doubled, they were increased through the pandemic and the concerns about the virus. When we look at what many people experienced, we stayed at home for a long period of time. Not the first thing that you recommend for folks that are struggling with mental health issues. It would be quite the opposite, in fact. We would recommend connection with family and friends. We would recommend getting out and doing things and being part of a group and exposing yourself to new opportunities, having goals that you set. Those things kind of drifted away as we needed to stay home to protect ourselves during the pandemic, during the height of the virus. And so you saw people then start to react. Their mental health was challenged. Our children and many of our family members and our loved ones stayed home from work, stayed home from school. When I talk with folks with children, I have children in high school and college as well. Our college students losing their first and second year, perhaps, of a very brand new experience, to go from having that first opportunity to be a freshman in college and live away from home, to either being in a dorm room with people you didn't know, on a laptop in a room taking your classes. You lost so much of that experience to, our younger folks to have to learn, and our teachers having to have to pivot so quickly to teach, on platforms that they never used before, and to build curriculum and engage students so that they didn't lose them. Our youngest, who can they sit still for kindergarten and first grade in front of a screen, to our mothers and our fathers who had to be both employed on one side of the room, maybe virtually, and teaching and supporting technology for their child on the other side. It's not surprising that you hear that the numbers increased so significantly around anxiety, around stress, and around trauma. And now the things that you would seek out for help weren't available necessarily. While Bergen New Bridge Medical Center has been available throughout the pandemic as an entity and virtually, our community providers needed to figure out, as we did quickly, how to pivot. And when you're not in your office and you didn't have access to all of the protective measures, there was a lot that people had to figure out as companies. Many companies are still not fully back to housing their employees, and may not choose to ever. So when we look at the mental health issues that present, I don't think any of us should be surprised and shocked at folks that maybe in the past did not have what they would consider to be a mental health issue, and now are finding themselves in a situation that they are struggling with loneliness, struggling with fear of the virus. Some of us, some folks stayed home for so long, they're afraid to reintroduce themselves to the community. Now the vaccines are available to all of us, but not everybody is comfortable. We certainly promote vaccines. It is the pathway to stop the spread. We host a large vaccination and testing program here at Bergen New Bridge Medical Center, including walk-ins now, and we highly encourage that people be able to get back to normal. But there are still folks that are still afraid, that they still are not ready to do that. And that idea now to leave that home is really very difficult. And if you think about it for our seniors, who were really hit the hardest by the pandemic, that idea that I'm going to be okay and that I'm going to walk out that door is a struggle they didn't have to have before.
Right.
And today they have that struggle. And while somebody may say, I'm ready to go and I'm going out the door and I'm going to drive, or I'm going to go, that's really wonderful. But there's somebody else it can be paralyzing. And so they need to be able to seek out that support and that help, to talk about what that fear is, talk about what that anxiety is. Many of us, many folks have lost so many of their loved ones. There is such trauma associated to that loss. It's hard enough to lose someone, but to have lost someone to COVID-19 and potentially not been with them, to have not been with them at their long-term care placement and setting, to not be able to visit, to not hold somebody's hand as they left us and moved on, that trauma stays. If you lost a loved one and experienced that trauma, it's exemplified now for us as a nation. So many of us are touched by that loss. And not everybody has the coping skills that they need to be able to get through that chain of loss, the grief, the frustration, the anger, the resentment, and be able to continue and move on with the day-to-day life. And of course, that day-to-day life is now with a mask on. Right. So it's wonderful to be able to see you in this moment. But normally, when we see each other, we have a mask. And so we lose that connection to our faces and identifying each other. I mean, how many of us have passed somebody and not realized that we knew them?
Yeah.
Because you're behind the mask. And, certainly for us in this field, the mental health field, a lot of what we do has to do with emoting and being able to assess our feelings. We wear them on our faces. And it has been a big challenge for us to be able to work and help people when they have a mask on to be safe. This is where the virtual technology has actually been a wonderful asset, because while over virtual, we may not be in the same room, we can see each other.
Right.
And
right.
so you can see how we're feeling, and we can talk about what's happening for you. And you're not smiling now, but you're telling me that you're okay. And I'm just wondering, are you really? So it has been a challenge for us as a community and a field, but I have to say that I think that we're coming through it amazingly well. We've learned a lot. We still have a lot more to learn.
Of course. So the medical center was the first hospital to be declared stigma-free.
Yes.
When we say stigma, what does that mean with regards to mental health treatment?
So, as I said, earlier, for so many folks, the idea that they are struggling with something that impacts their mind makes it so that there's something wrong with them that's different than having to manage, again, having a diabetes, having a heart condition. When I do a lot of teaching, I often talk about labels when it comes to stigma. When we talk about somebody with a heart condition or somebody with a diabetes condition, cancer, standard medical things that many of us have family members that have been touched by. If I were to ask a training class how many have been touched by cancer, the hands will go up. How many have been touched by heart disease, the hands will go up. But when I ask them how many have been touched by mental health issues, the hand doesn't go up so quickly.
Yeah.
Some do, not many. Many will speak to me after a presentation. We don't refer to folks with labels who have a medical condition, but sadly, we have in the past, and we're trying to move away from it with our stigma-free initiatives, have been referred to as schizophrenic, bipolar. These are labels and diagnoses. This is not a person. We need to move away from the labels, and we need to welcome people for the care that they need. And so that stigma of being identified that way, and it's not just our mental health community, it's also our LGBTQ community, it's many, our transgendered community, where it's not quite acceptable in society yet, that label pulls people away from identifying. And that pull away also stops people from seeking out the treatment and the services that they need. When we look at the reasons why folks don't come for service, more times than not, the response when you look statistically is due to stigma.
Yeah.
It stops folks from coming to the door and opening it. It stops them from asking for the help they need. It keeps them from sharing how significant it is. It keeps them from wanting people to know, because the school will find out, because my children will be taken away, because I won't get insurance, and all kinds of things along that lines. So that's where we look at that stigma and how it impacts our population of patients that just need to come, or consumers who just need to come and get the help that they need. The help is here. It can make the world of difference in someone's life, but the door opening is a challenge. And that is unfortunately something still today. I'm very proud that we are the first medical center to raise the stigma-free flag, but I've been involved in stigma-free initiatives through a large portion of my professional career, and here at Bergen New Bridge Medical Center as well. And we have to do more than raise the flag. We have to embody the movement. We have to open the doors. We have to change sometimes our practices and be sensitive and compassionate and kind to what the issues can present for somebody, so that they get the care that they need, and they can speak proudly of coming to the service here at the hospital and help somebody else come here. So tomorrow, we're going to raise that flag again at 11, as we have since the first time annually. But I think it's important for folks to know that it's more than raising the flag for us, and it needs to be more than that in all of the different areas that people are going to acknowledge that stigma-free initiative tomorrow. It has to embody your service. It has to translate to the folks that you serve. It has to present through your staff and through your activities. You have to live and breathe it. It has to be the cornerstone of what you do and how you provide your care, so that it actually is more than just acknowledging the day.
So moving on to talking about care, what's the best way for someone to get information or schedule an appointment for mental health services here at Bergen New Bridge Medical Center?
So there are a variety of ways. We, of course, have a very large web presence that, you can go right onto our website and you can access care and information about us at any time. But also, too, you can reach out to our Access Center. We provide a screening for the various different services that we provide here at the medical center. Not when folks call to seek out care, they don't always know what we have to offer, and they don't always know what they need. So we have a wonderfully trained professional staff that will be able to hear what the caller is presenting, what they feel their needs are, and talk to them about and assess what those needs are, so that they can determine how they can match them to the best service, how quickly they need to come in to that service, and what the different requirements are for them to be able to get in, so that when we provide them with a virtual appointment or perhaps an in-person appointment, it's seamless. Everything is done and in place. And when they come to the medical center, if they choose to come in person, that they get through our screenings and checks for COVID-19 that we still do, and that they then move to the place where they're going to get their direct care, and everything is all wrapped up and good to go, so that they can get directly to that provider and start the work that they want to do on their mental health care. So our access department has an 800 number for behavioral health and addictions, and I'm going to look at it so that I can give it to you. It is 1-800-730, I got to stand up, 2762. I should have had that in front of me. And that gives you immediate access to those trained professionals who can provide that assessment in the moment and then link folks to the right service for their needs.
And finally, Kris, share with us, is it safe to return to in-person care, and why you would recommend mental health services here at Bergen New Bridge Medical Center in particular?
Absolutely. Thank you, Ro, for asking. I think it's very important for everyone to know that the medical center is got very strong and very stringent protocols that we have in place to be able to protect our staff, our patients and consumers on site, both in our inpatient care and in our outpatient care. We have very strong protocols to keep everyone safe, so that it is possible for folks to come in person to care and be able to get the care that they need without worry or fear that they are exposing themselves in any way, and that they could be impacted further by this virus than perhaps they already have. I think I mentioned we provide vaccines and testing, on a daily basis, and we offer that to all consumers of care here at the medical center, and that we understand that not everybody's ready to come back, but we want them to know that if they are, that they will be safe here at the medical center, and that if they choose not to, that we are available to them in all of our service provision virtually, and we can help them to talk about that concern and those fears and help them to be able to come back to the medical center and be able to be in person if that's what they so choose. I do think, Ro, that our mental health field has pivoted to virtual, and I think it will be here to stay. But I think it's important for folks to know, if they're seeking care, that is not the only service that we provide. And so we are here for them both in person and virtually based on their choice. And we'd be happy to have them.
Well, thank you so much, Kris, for taking the time, and everyone who tuned in. For more information about the services at the medical center and to learn more about how to support the foundation, please visit us at newbridgehealth.org. And thanks again, Kris. It was really great speaking to you.
Thank you, Ro. I appreciate it. And thank you to everyone.